Welcome to this course on understanding the cultural competency training requirements for healthcare providers in Nevada 2025. My name is Jay Cafretta, and I'll be your host today. A little bit about me. I have a master's degree in communications, a degree in deaf studies, and I'm also a certified diversity executive. I teach cultural competency courses for healthcare providers as well as professional development courses. I've been involved in the legislative processes that have created these laws around cultural competency and have personally testified on these bills while they were being created in many of the different sessions of the Nevada legislature. I am not a lawyer, and as such, I recommend that you check with your supervisor or whoever it is that you report to about whether or not these things apply to you. Other states may have similar laws, but the ones I'm discussing here are Nevada specific. Again, please check with your administrator, supervisor, or licensing board as to the application of the laws and how they impact you. I am not a lawyer, and my interpretation may be different from the licensing board or the Department of Health and Human Services. Today, we will be discussing NRS 449 and the NAC as it pertains to that statute. So let's get started. So what are we talking about? Most of these were updated in 2023 or 2021, and as each legislative session completes, some of these things will change. In Nevada, we have a biannual legislative session that lasts for a regulated 120 days. All new legislation must be introduced, heard, and passed by both the Senate and the Assembly before heading to the governor's desk. If a bill makes it to the governor's desk to be signed, it is considered enrolled, and if the governor signs it, it becomes the law effective as each bill states. And the reason why I'm telling you that is because when you look on the Nevada legislature's website, you will see different versions of every bill. It goes through every iteration of how that bill was discussed and passed and amended, and you'll see it as enrolled, and then you'll see it as signed. So please look at the Nevada legislative website for more information about these different sessions and the different versions of these laws. On this slide, you'll see that these are the chapters of the law that pertain to cultural competency. And I have a course on each or every one of these, and you can look at those and to see which ones are required for you. If you are a professional that works under one of these chapters and you also work in a licensed healthcare facility, then this course will help you to determine what is required of you, your licensing board, and the facility. So, one of the things that I get asked all the time are, what are licensed healthcare facilities in Nevada? Well, there are 25 or 26 different types of licensed healthcare facilities in Nevada. If you work in one of these, you are required to take a state-approved cultural competency course. And again, you may be able to see that some of these are something you've never heard of before, such as a mobile unit. Those are things like the Mama Van, a recovery house, and those are places that people are in recovery and are being treated for many different kinds of things. Again, this is just the list that is listed in Nevada for licensed healthcare facilities. So when we look at the different parts of this law, we can look at Section 103. And this is about the regulations that are going to be used to enforce this law. But right now, under NRS 449.0303, we're talking about a facility that is required to conduct training relating specifically to cultural competency, or any agent or employee of the facility who provides care to a patient or resident of the facility. And again, the whole intent is to make it so that employees and staff members better understand patients or residents who have different cultural backgrounds, including without limitation, right? Patients and residents who come from different ethnic or religious or cultural backgrounds. Again, the facility must provide this training to the staff. However, if you are required to complete cultural competency training as part of your professional license, the facility is not required to provide this training to you. You must complete this on your own as part of your own license requirements. So in a nutshell, what are we talking about? We're talking about who must be trained. That's agents and employees who provide clinical, administrative, or support services and have regular direct patient contact, as well as their supervisors. That's within 1 week. If you regularly have contact with patients during the week, then you are required to have this training. The initial training is within 90 days of hiring or contracting. Now, if you're a facility that's been in business for a while, obviously you're not hiring everyone right away. However, once you do have a new hire, they must be trained within 90 days. It is also biennial, so at least 4 hours of training every 2 years after the initial training. Again, the only exception is if an employee or staff member has completed cultural competency as part of their continuing education for license renewal. So, what is it that has to be done? Well, the course cannot just be any course if it's going to meet the requirements of NRS 449. It has to be approved by the state. Now, currently, there are several ways to get this training. Some facilities have created their own in house version, and some folks use third party vendors. The vendors then carry the burden of curriculum development and the entire approval process created by the state. And that is really important if you're a smaller facility. It's typically much easier to just use a third party provider to get your staff trained so that you don't have to go through all of these different aspects of creating and developing and then providing this training. So, what is actually required under NRS 449.103? This is the current version of the law, and these are the things that reflect who you must include in a cultural competency training. Now, I often get questions about how do I get my training approved? And I say, well, it's very clear. It's written right there in the law and in the NAC. But here in the law, NRS is Nevada Revised Statutes, and these are the topics that must be included: various racial and ethnic backgrounds, religious backgrounds, various sexual orientations, gender identities or expressions, children and senior citizens, persons with a mental or physical disability, and part of any other population that such an agent or employee may need to better understand as determined by the board. Now, this last one reflects the patient population that a facility might serve. For example, if 40% of your patients are Spanish speaking only, the facility needs to support this population and offer their staff training about the cultural norms and language barriers of a patient or resident that only speak Spanish, or if they only speak Chinese, or if they come from a certain place. Um, in Las Vegas, we have a huge population from Ethiopia. And so understanding their cultural norms and understanding of how they expect the healthcare delivery system to work might be really important. One of the other things that we talk about is the sources. Now, again, these are the things that are required. You can't just make things up. They have to be from these different places. So it has to be evidence-based, peer-reviewed sources. Anything that's used at a university or college that's accredited, nationally recognized organizations, or anything that's published or used by a federal, state, or local government agency. And again, any other source materials that are deemed appropriate by the department. So these are the minimums that must be required when you have a training that is going to be approved. If you are trying to get a training approved, these are the things you need to do. If you are looking at, does this training meet these requirements? Then these are the things that must be included in that training. It can't just be someone's opinion about these ideas. It actually has to be responsibly sourced that are approved by the department. Now, here are the two links that you might need or want. You can take a picture of these, or you can look at them up under NRS or the NAC in Nevada online for the correct chapters and subsections. And again, I ask people to make sure that you look this stuff up yourself. You don't need to rely on me or trust me for whether or not these things are true. These are readily available to the public, and you can find them here. Now, again, I want to go over this idea that professional licenses and facilities. If you are a licensed professional and you work in a licensed healthcare facility, you have to take a training that is acceptable and approved by the state. If you are just working as a licensed professional, you may have different requirements in terms of cultural competency training hours that you need, and that will be determined by your specific licensing board. If you're a nurse or an MFT or a psychologist, I'm sorry, or a psychology assistant, then you are required to have 4 hours of CEUs. If you are a drug, alcohol, gambling counselor, you are required to have 6 hours. So again, you need to check with your licensing board and see what they have about what courses are approved for them. If you take a state approved course, then you have met the requirements of your licensing board. So again, why take two courses when you can take one and get a certificate that meets all of your requirements? Third-party providers are the ones you want to use if you're in this dual employment or if you work for even more than one facility. Many times nurses will work for a juvenile detention facility, a skilled nursing facility, and also a doctor or a private healthcare provider. And those all have different requirements for cultural competency. I am a third party provider, and you can find different levels and different numbers of hours available on my website for meeting those needs for you. So, in conclusion, right, you need to know the training must be taken within 90 days of hire or within a 90-day limit. The training can be live or online, in person, or over a platform like Zoom or Teams. And again, the links are available for your edification. If you want to know more information or if you'd like to know more of the specifics, you certainly can look up NRS 449103 or the NAC 449. So the facility must provide that training to all staff, including supervisors. That means the CEOs, the CFOs, all of those things, because they supervise people who provide direct care. Content is specifically laid out in the regulations, and to meet NRS 449.103, it must be approved by the state. So, again, if you'd like to know more about these different professional licenses and their requirements, I have other videos available on my website for that purpose. However, any course that you take that's approved for NRS 449.103 will also be approved and accepted by any and every licensing board in the state of Nevada. If you have questions or comments, or you'd like to reach out to me after this, please feel free to contact me at this email address, or you can look up my courses at adultsensitivitytraining.com. Thank you again for taking the time to attend this presentation, and I hope you have a wonderful day.